Yes, hello, ma'am. Ma'am, you can start the lecture. The
Yes,
rest will
yes,
join
yes.
in between. Thank you, ma'am.
Okay, not an issue. So today we'll go with the pathogenesis of the chemical injuries and the physical. The last time we have seen what are the changes happening at the cell level. Okay, pathogenesis of ischemia when the cell are not getting oxygen. Okay, that has been clear to you all. So today I'm going to tell you the overview of the chemical and the physical injuries. So in the chemical, we have two. If the chemical components are getting in contact with the cell directly, and the others are they are coming into the body but getting dissolved in your alimentary tract or somewhere else, and then reacting and then becoming toxic. That is the indirect way. Okay, so there are two ways for the chemical injury. The first is direct one, direct cytotoxic effect. Now, in this, some chemicals combine with the components of the cell and produce direct cytotoxicity without requiring the metabolic activation. In in the indirect way, what happens? The toxins are coming into the body, but they are not getting activated until and unless they reach to certain organs like liver, kidney, or your alimentary tract. Then they get activated and then they react. Okay, those are the indirect ways. Direct way में क्या होगा? What will happen? As soon as the cell is coming in contact with this toxin, the cell injury happens. Okay, there is no other way. There is a only direct way when the this toxin are coming into the direct contact. So examples are the mercuric chloride poisoning. This element is present in the you have seen the workplaces like painting or those are the things like POP happening in the large constructions. This is the chemical present in that. Okay, so the people who are working in constructions, who are working in meals like painting and other things, the color one, in those people, this toxin are happening. Majorly the one are exposed to the chemical to the factories, pharmaceuticals, those can have this one, mercury chloride poisoning. The greatest damage occurs to cell of the alimentary tract where it is absorbed and the kidney where it is excreted. So what happens in this element coming to the body and it is absorbed in the alimentary tract. There the poisoning has been seen, and other is the where it get excreted in the kidney. Okay. Cyanide kills the cell by poisoning the mitochondria. The other example you can say is cyanide. Okay. So other direct when giving the chemotherapy to the cancer patient. Okay, the radiation. Even in physiotherapy, when we are giving ultra waves, IR waves, infrared waves, we are giving direct exposure. More than 15 minutes for more than 7 days or a month, or someone is taking for larger period of time. If it's not given in optimum distance or for optimum time, they get this radiation, and there is particular some to some extent there is a cell injury happening over there. Okay, certain people are having boils, certain are having blackish in color, the skin gets blackish in color. Okay, so those are the symptoms that is happening in physiotherapy. Understood? The other is the conversion to reactive toxic to metabolites. This mechanism involves the metabolite activation to yield ultimate toxin that interacts with the target cell. The target cell in this group of chemical may not be same cell that metabolize the toxin. Example, the cell injury by conversion of reactive metabolites, the toxic liver necrosis caused by carbon tetrachloride. Now, when the people are taking some medications like analgesic, antipyretic, okay, it's for giving you a simple example, when we are taking antibiotics, okay, in the higher dosage, like more than 600 mg, or those are the dosage, what happens to some extent, we have a side effects of diarrhea or something. So those are the things when we take something for some target cell, but that cell are not getting affected, but as a side effect to certain level, the organs or the other systems are getting affected with them. So, for example, in the medications, these things happen while we are giving it a high dose, anti-inflammatory, analgesic. So, they have their own side effects. So, these are coming into when it comes to reactive state. Okay, until unless they are not in the reactive state, it doesn't come. So, it's not coming to the occupational thing, but through the medication or through the overdose of something is happening. Understood? So in pathology of chemical injury, you just have to write direct and indirect, and you just have to give one example to each. And the physical one, you have to give the example of any burns happening, any shock state, atmospheric. So whenever the patient or the person is coming into that atmosphere, and physically they're getting injured like a shock, any radiation, any change into the blood pressure, any change in the atmospheric pressure happening, direct contact with the patient, that is the physical injuries happening to the cell. Just for example, in the factories when they are having fumes, okay, due to the high doses of fumes or due to the high dosage of the air, that such to some level people are having injuries. Okay, those are the physical one. Radiation injury to the human by accident, therapeutic exposure to the importance treatment, malignant tumor, as well as many carcinogenic influences. So these are the diagram you can put, but it's not important. But for understanding, know this: the ionizing radiation when it's coming in contact with H2O water, the we people are having, the humans are having majority of the things in fluid. So we have a high level of H2O in our body. So what happens? It attacks both the cells, for proliferating and non-proliferating cells. Okay, so in that both things are getting damaged, DNA as well as the lipid. Okay, so this diagram you have to make. Either you can do this in physical one or you can explain it. Okay, so in chemical you have to write direct, indirect. In physical you have to make this diagram. So what are happening in the cell level? DNA damage, lipid peroxidation, cell membrane damage. This is the similar one which is happening over here. This one, this one. Okay. So now this topic has been done, the pathogenesis. There are three pathogenesis we have studied in last two lecture. First was the ischemic, second is chemical, and the third is physical. So whenever if I'll come up with a question that you have to explain the pathogenesis of the cell injury, you have to include the chemical, you have to include the ischemia, and you have to include the physical one. Okay. Now what we are going to see is morphological changes. What are morphological changes happening? What means once the injury is happening, what are the things happen in the cell? Now we saw what is happening in cytoplasm, what is happening in sodium, what is happening, but we have to see in the layer wise. Okay, so these are the main four things that happens in the cellular level, in the tissue level. Okay, what we learned was the cellular level, and this is the tissue level. What is happening in the fatty tissue? What is happening in the mucoid change, in the hyaline layers, and the hydrotropic? So these are the four changes, and you just have to explain. You just have to give the definition. You don't have to go into the depth. So I'll just explain you this four today. Okay. So the morphology of reversible cell injury, after having discussed the molecular and biochemical mechanism. Molecular and the biochemical mechanism is the one we just started, the pathogenesis, okay, of a various form of cell injuries. We now turn to the morphological changes, means the structure, the cell structure, epithelial cells, squamous cell, these are the cell getting involved in that. So we now will go through the structure thing. We are seeing what is happening at the chemical levels, but now we'll see what is happening at the physical structure. Reversible and irreversible, both we are going to cover in that. In older literature, the term degeneration was commonly used to denote morphology of reversible cell injury. However, since this term does not provide any information on the nature of underlying changes, currently the term retrogressive changes or simply reversible cell injuries are applied. Now, these are the four normal changes happening. Reversible means if these things are happening, the cell injury can be reversed. Okay, the first is hydropic changes. Now, this is the commonest changes we all have seen. For example, if we are getting a burn, normal burn, while cooking something or anything, normal burn we are getting, what are the first reaction we see in our cell? That there is an accumulation of water over there. Okay, we'll see some boils, a minute water accumulation in our skin. Okay, that is the first structure changes happening in after the cell injury. So hydrophobic changes means accumulation of water within the cytoplasma of the cell. Other synonyms used as cloudy swelling, you can say cloudy valvular degeneration. Okay, this is the commonest and the earliest form of the cell injury from the almost all causes. No matter what is the cause, this is the first sign we see in the morphological changes that is happening in the cell injury. The common cause is acute and subacute. It cannot be seen in the chronic. Chronic में क्या होगा? The cell will get dead. The fibrosis will be happening. The cell will get hardened. Okay, those are the chronic changes happening. In acute and subacute, what we see is the accumulation of the water over there. Understood? So what are the example in that? The common cause include acute and subacute cell injuries from various etiological agents such as bacteria toxin, chemical, poison, burns, high fever, intravenous administration of hypertonic glucose or saline. Okay, even in high fever what happens we cannot see, but at the organ level the accumulation of water is happening. We feel dehydrated during fever is one reason, because that water is getting accumulated in the injured area or in the layer of the organs. Okay, now the pathology, you don't have to go to pathology, but it's a simple thing. The capillaries get swollen, tubercle cells get swollen. These are the changes happening in that. At the cell level, what happened? The same I have explained to you, the sodium and potassium influx. What happened? The sodium is not allowed to go outside and potassium cannot come inside. So the majority of the sodium is accumulated over there along with the water. That is the thing happening in this. So hydrophilic, you just have to explain that is the accumulation of the water and it's seen majorly in acute and subacute injuries. And this is the most common and the first reaction have been seen in the morphological changes. Okay, these are the 3 points you have to include in this. When it now you have to see this diagram you can make when we are saying you have to classify it. There are 4 to 5 types of morphological form of cell injury. First is reversible. It means degenerative changes, but you can come over it. You can reverse it. Okay. Irreversible is necrosis. Necrosis, what happened? The cell is dead. There is no oxygen for more than 30 minutes or more than days are happening. There is no oxygen supply over there. So what happened to some extent? After that, there won't be, if the cell membrane has been ruptured, the cytoplasm has been burst, the ribosomes has been burst. So now there won't be a regeneration of those things. Okay. So those are the irreversible. Example, necrosis. The third is programmed cell death. Apoptosis means what happened? Too much of generation. Okay, the cells are generating too fast over there. So what happened? The one who are there already, they die. That is apoptosis. Deranged cell metabolism. In this, what happened? The lipid, protein, and carbohydrates are accumulated in certain places and they do not move or they are not used. Okay, when the lipid, carbohydrate, and protein are accumulated in the intracellular, majorly you will see, for example, in diabetic patients, what happens? The glucose or the lipid are accumulated in the cell, then it get accumulated in the blood as well because it's not being used. The accumulation level is very high, the usage level is very low. So what happened after the accumulation into the cell, it start accumulated into the blood. Okay, so that is happening, the accumulation of this three: lipid, protein, and carbohydrates. Okay, and the third is after effect of the necrosis: gangrene, pathological calcification. Gangrene, I think so. Is anyone seen the patient of gangrene in hospital or something? Can someone tell me who are more prone to get the gangrene?
Gangrene, who take the lots of cigarette, smoking, alcohol like
Hmm.
this.
And
He
even
can
diabetic
affect it.
patient, even diabetic
Yes.
patient. Okay, so they are very much prone because the healing process is very low in them. Okay, so even with the minor injury, what will happen, the healing process is so low that the cell death is very high. So after certain point there it will be necrosis, and if the stage goes away, if the stage is beyond to that, that is gangrene. Okay, so this five is clear to you: reversible, irreversible, programmed, ranged, and after effects of the necrosis. So if someone, if I ask you you have to give
সকালে পড়বে
classification.
না.
Yes, clear.
Yes, clear. Sorry.
Yeah, it's okay, it's okay. So I'm just telling you, while I'm explaining to you, I'll tell you how I'm going to ask you the question or how you can expect the question to be. Okay, so it will be give the classification of morphological form. If I ask you morphologically, so you have to give this five. Okay, you can just have to make this. You don't have to give any explanation to this hydropic changes or anything. You don't have to. You just have to make this table. If I ask for 5 marks, okay, you just have to make this. And if I just ask, see the give the morphology of the reversible cell injury, then you have to give this four: hydrophic, hyaline, mucoid, and fatty changes. Now the second is the hyaline. In this, what happened? The layer of hyaline in this, the fibrin layer, ammoid layers are getting affected majorly. Okay, it's very difficult to distinguish between this, and it happens in intracellular as well as extracellular. What is intracellular and extracellular? It's like inside the cell as well and the outside as well. Hyaline is a layer of a tissue. Okay, you don't have to go. You do not have to imagine a cell over here. You have to imagine a tissue. You have to imagine the skin and the layer of the hyaline. So what is happening at the cellular level in the hyaline? This intracellular is affected as well as the extracellular is affected in this. You do not have to give this explanation. Hyaline droplets, hyaline degeneration. These are the examples given, like proximal epithelial cell will be affected. In degeneration, rectus abdominis muscle called Zenker's degeneration occur in typhoid fever. So these are the example. If you want to learn, you can. Otherwise, it's okay. You don't have to go into this deep. Okay, you just need to know intracellular and extracellular. So intracellular hyaline is mainly seen in the epithelial cell, and extracellular is mainly seen into connective tissue. So whenever you listen to this, you have to imagine a tissue. You don't have to imagine the cell. Right now we are talking about the tissue. We're talking about the skin, the layer beyond the skin. Okay. In the mucoid layer, what happened? Mucus gland, everyone knows. Mucus gland. Anyone? Mucous membrane, mucus gland. It is present in our tissue. Okay. There's when we are getting that mucus formation, the sweat glands, these are the layers where it is happening in the mucus. The formation of mucus, any pus formation is happening, it's happening in this layer. Okay, the mucoid change, what happened? The mucoid means mucus like, Mucus is a secretive product of the mucus gland that is present in our skin. Okay, everywhere we have mucus gland. The combination of the protein. Mucus is normally produced by the epithelial cell of the mucous membrane and mucus gland, as well as by some connective tissue such as ground substance in the umbilical cord. These are the example given. Where are they present? Like in the uterus, in the gallbladder, in the oral cavity, in the cystic fibrosis, pancreas. So these are the organs which secrete. Okay. So when it comes to mucus, you have to think about the area or the regions where the majorly secretions are happening are the uterus, respiratory tract. Okay, where there we have the mucus accumulation majorly in the respiratory tract, in the uterus, in the alimentary tract. If there is any obstruction, that gallbladder, pancreas secreting the bile, okay, when there is a secretion and when there is an inflammation in those areas, this is called it mucus changes. Okay. Then we'll see the fatty changes. These are the fatty tissues. Now, fatty changes, what will happen? The metamorphosis is the intracellular accumulation. In this, what happened? Parenchymal changes. You know all the cell, epithelial cell, squamous cell, parenchymal cell, connective cell. So in this, which cell are getting majorly include are the parenchymal cells. Now, can anyone tell me where we can find the majority of the fatty cells in our body? Fat metabolism is happening in which organ? Which organ does the fat metabolism?
Liver.
Yes. Liver is the only place where the fat metabolism is majority happening. Okay, so where we will find this fat changes? In the liver. Which cell? Parenchymal cell. Now this include the older and now abundant term fatty degeneration. Majorly the infiltration, the deposit of the cytosol and represent the absolute increase of intracellular lipid. What happened in this? The fatty acid are the lipid. Okay. So there is a majority, like high level of accumulation of the lipids, which we have seen in this now. This one, deranged cell metabolism, intracellular accumulation, lipid, protein, and carbohydrates. In that, we have to see that this changes is happening in that. Fatty changes will be seen. Fatty liver. Liver is the commonest site for accumulation of the fat because it plays central role for the fat metabolism. Depending upon the cause and amount of accumulation, fatty changes may be mild or reversible. Severe, if it's severe, it would be irreversible. Now, what are the conditions that we will see the fat accumulation? The simple is obesity, diabetes, con congenital hyperlipidemia. Yeah, have anyone heard about this congenital hyperlipidemia? Anyone? Now, this is the condition majorly seen in the babies who are genetically obese. Okay, they have someone say na it's a hereditary. Her mother, her father, they were so they have this condition, congenital hyperlipidemia. In that, what happened? The accumulation of lipid is so much, the production of the lipid is so much that usage is very less, even though they are exercising to the same level of someone who has. Someone says na they have a nice fat metabolism, they have the nice metabolism. So what happens in this patient or in this people, the metabolism is very low of lipid. Okay, so when you say fatty liver, in this three conditions are coming, which will increase the accumulation of the lipid. The first is obesity, the second is diabetes, and the third is congenital. Now, the liver damage can be done through what? Alcohol. If someone consumption is too much of alcohol, that will be leading to cell damage. Now, this condition in which the fat cannot be metabolized due to liver cell injury. Just imagine the cell are injured now. The metabolism won't be happening. Okay. So the other is starvation, chronic illness like TB, acute fatty liver in late pregnancy, hypoxia, anemia hai, hypotoxicity, carbon tet. How does anemia will cause this? Does anyone know any correlation of this? Anemia, hypoxia.
Iron deficiency.
Yes.
eh,
So when there is a iron deficiency, the blood circulation will be very low. So for any metabolism or for any generation, we need, for any process of energy, we need oxygen. So when there is no oxygen, the level is very low. So this will go and affect the organ. So when you say there is a less amount of oxygen in the body, so what we say now, the organ failures are happening. So these are the things happens at the organ level. In liver, what happens? They have this failure, hypoxia, because of the less oxygen, because there is a less circulation of it. You don't
reduce
have
of oxygen.
what? You said something?
Hypoxia means, madam,
When the
oxygen
oxygen
reduce na?
is less, the circulation of oxygen is very less. So what will
Hmm.
happen when there is no oxygen? The ATP generation would be there. The metabolism, the energy we require to metabolize the lipid and change it into the ATP, we do not have that. So what will happen? The extra accumulation of lipid will come or happen into the liver. So these are the conditions in which you can see the liver would be affected. The organ is affected because of the accumulation of the fatty tissue. Okay, now we are just learning how the tissues are affected. First, we saw when there is the accumulation of water in hydrophilic changes. The other is hyaline changes. Okay, intracellular, extracellular. Then mucoid changes when there is a pus formation, when there is a secretion is happening, too much of secretion or the secretion has not been happening. So that is the third reason. The fourth is the fatty acid, fatty liver. Okay, fatty changes happening over there. Means what happened when I say fatty changes means the lipid are getting accumulated. It is not being used. Why it's not being used? So these are the reason. Etiology is the reason, the cause why the lipids are staying over there and not being used. So one is obesity, second is diabetes mellitus, other is congenital. And if the liver cell are damaged, how the cell would be damaged? The cell are not optimal or having the capability of changing or metabolizing the lipids. The cell itself is not. In first reason, what was there? The fat accumulation was very high. The cell were good. They were not damaged. Liver cell were working very fine, but they have to work too much. They couldn't work to that level, which level the lipid was present. The accumulation of the lipid was there. In second, what is happening? The cell are injured now. The cell itself are not capable of doing the lipid metabolism for so and so reasons, starvation, alcohol, when there's a chronic illness, hypoxia is there, acute fatty liver in late pregnancy, you can see. Okay, those are the things. Understood? Morphology of reversible cell injury. Anyone? Any doubt in this?
No, madam.
Huh. So I'm just giving an overview view because we don't have to go into depth of everything, the pathogenesis or the pathology of it. You just have to have an idea okay, when there is a cell injury, what is happening at liver, what is happening at the organ level. Okay. So you should know, okay, morphologically what are the changes happening, and pathologically in the cell what is happening. Morphologically is at the level of tissue we are talking. Understood? These are the two main things that you people need to know in cell injury. Pigments, you don't have to know, but I'll give you a small definitions of this, so you'll have a overview of it. Okay, it's not an important topic. Then we'll take the morphological irreversible cell injury. In this, what happened? There is a cell death, gangrene, necrosis. Those are the things happening. So we'll go in detail in this. Okay. So tomorrow I'll take this lecture, morphology of irreversible cell injury. Do you people want me to take tests once a month, or is it okay? Like a class discussion, whatever the things has been taught, like after 10 lectures or something, just to refresh it. Anyone? So these are the two main topics will be remain. Next two lecture will cover. First lecture will take the morphological of irreversible cell injuries. Okay. Then the second important is the changes happening after cell death. What are the changes happening? The gangrene, you see now this gangrene, wet gangrene, dye gangrene. This is important. Okay. So we have two topics left in this. Any doubt over here?
No, madam.
Okay. Till here you understood. Now you got an overview. If you'll read it out again, you'll understand, right? If you want, I can make a question paper as well for you people. After once the one topic is done, one chapter is done, I'll just give you those points. Okay. Any doubt? No?
No.
Okay then. So by next week, we'll complete this chapter. Okay. Means this week we'll complete.
Thank you, madam.
Okay.